Informatics is a new and vital field that is revolutionizing the health industry. With the power to connect information, technology, and people, health informatics has a direct impact on the quality and cost of care. And it plays a critical role in addressing important public health issues. The explosion of medical information and the availability of new technologies has created a demand for skilled professionals to manage and interpret clinical and public health data.
The use of technology in nursing is not new. In fact, nurses have become proficient in utilizing and adapting complex technology into care and nursing practice for decades, at least since the times of Florence Nightingale. Nurses have been using medical machinery and physiologic monitors in the care setting. Driven by advances in information and communication technology, nursing has evolved significantly for the past few decades. It has been shown that information and communication is imperative in the health practice. Nurses being the largest group of healthcare providers, they must be competent in the use of information and communication technologies. This realization started the steady development of nursing informatics. History of nursing informatics. The French Connection. Francis Remy, a Frenchman, is credited with the first coining the phrase "informatique medical". This term, when translated to English language, means medical informatics. The term was subsequently defined as information technologies relating to the care of patients. Such information was aimed at helping the medical process of decision-making. The Tokyo Med Info Conference. The language of nursing informatics was first used in 1980 in an address presented to the Tokyo Med Info Conference by M. Scholars and D. Barber. As the nursing profession continued to take on more significance to post-industrial societies, it became necessary to develop a body of language dealing with the nursing profession. Nursing informatics evolved during the second half of the 20th century. The history of nursing informatics in the Philippines. The Philippine Medical Informatics Society (PMIS) and its founders had strong influence in the development of health informatics in the Philippines, headed by Dr. Alvin Marcelo. In 1998, several faculty members of the University of the Philippines began formal education and training regarding informatics. Dr. Tolentino took a postdoctoral fellowship in medical informatics at the University of Washington. Dr. Marcelo followed a year later for his training at the National Library of Medicine. Dr. Cito Maramba went to Coventry for his master's in information sciences at the University of Warwick. They were later followed by other physicians such as Dr. Michael Muin and Dr. Ryan Banyas. They are some of the physicians that are the board members of the PMIS. By the year 2003, a Master of Science in Health Informatics was proposed to be offered by the UP Manila College of Medicine. The College of Arts and Science majored in bioinformatics and was later approved to be offered starting academic year 2005 and 2006. In 1999, a study group was formed headed by the National Institute of Health of the University of the Philippines, Manila. This group identified international standards for health information and their adaptability in the Philippines. The document is referred to as the Standards of Health Information in the Philippines 1999 version. Informatics course was included in the undergraduate curriculum, which focused on desktop applications. In 2008, the need for genuine nursing informatics had been realized in the undergraduate curriculum and was defined by the Commission on Higher Education Memorandum Order 5 Series of 2008. This was later revised and included as Health Informatics course in CHED Memorandum Order 14. The Philippine Nursing Informatics Association. Two nurses and graduate students of Master of Science in Health Informatics at the University of the Philippines, Manila, began drafting plans to create a nursing informatics organization. In February 2010, they began recruiting other nursing informatics specialists and practitioners to organize a group which later became as the Philippine Nursing Informatics Association and will later joined by other nurses. The benefits of nursing informatics in clinical practice, in administration, in education, and in research. The benefits of computer automation in healthcare. Improved access to medical record. The EMR can be accessed from several different locations simultaneously, as well as by different levels of providers. Decreased redundancy of data entry. For example, allergies and vital signs need only be entered once. Decreased time spent in documentation. Automation allows direct entry from monitoring equipment, as well as point-of-care data entry. Creation of a lifetime clinical record facilitated by information systems. Increased time for client care. More time is available for client care because less time is required for documentation and transcription of physicians' orders. Facilitation of data collection for research. Electronically stored client records provide quick access to clinical data for large number of clients. Improved communication and decreased potential for error. Improved legibility of clinician documentation and orders is seen with computerized information systems. Effective data management and trend finding include the ability to provide historical or current data reports. Extensive financial information can be collected and analyzed for trends. An extremely important benefit in this era of managed care and cost cutting. Once upon a time, there were nurses who were charting. One was getting tired from all the writing, and one couldn't do her job well because she couldn't understand the doctor's handwriting. They wished there was a solution that would help them make their work easier. I'm getting too tired of writing every single thing in this chart. Computers and iPads are now being used by nurses to record their data. Could you get me the file of Mr. Bertie? I need to see his medications chart. It says here that he needs to take his BP medications for 8 o'clock. I could check my patients and prescribe their medications through the computerized system. I could even monitor and record my patient's vital signs on the computer. This system helps me plan my nursing care plan and even reminds me to do them. I don't even have to use my Tickler and BP app anymore. My nursing iPhone can do that for me. I even get to monitor my patient's vital signs anywhere I go. Nursing informatics is so cool. Technological advancements. New and improved hospital beds. These hospital beds can assist caregivers in getting patients out of bed, provide pulmonary therapy, support built-in skills, and patient positioning features. This has a bed tracking software that could let you pinpoint the exact location of any bed in the facility along with its status. The Fluent Chart version 2.0. This chart gives users the ability to access and manage patients' clinical information effectively from anywhere. With the use of Fluent Chart, patient care tools such as chronic disease management, prescription management, computerized physician's order entry, clinic flowcharts, structured and unstructured medical notes, and nutritional notes are at your fingertips. The Smart Infusion Pump. Computerized provider order entry. The CPOE is a process where medical practitioners enter orders in the system at the point of care. These orders are signed and transmitted through the network to departments responsible for fulfilling the order. Computer input processing output. How it is related to the nursing process. The computer process. First is the input. Data is inputted into the computer using different hardware such as the keyboard, the mouse, the camera, the scanner, and the like. Second is the process. This data are then processed by the CPU where it will be read and analyzed. Third is the output. The data processed are now going to be shown to the person who inputted the data through different hardwares. How is the computer process alike to the nursing process? The nursing process is very much like the computer process. Nurses do it all the time without actually being aware of it. Nurses always inputs data, process it, and gives an output on it. It is vital to their profession and very imperative in the clinical area. Input. Nurses always input data in their minds by reading, studying, listening, interviewing, and observing. Most of it happens in the area and in the classroom for nursing students. Process. After getting all the information, the nurses then process this information in their minds and understand it. They assess and understand what the data is about, if it is important, if there are certain things that need attention. Output. After understanding and processing said information, the nurse then acts upon them and on the patient or in the area. This now becomes the output as the nurse will bring about the data that she processed and understood into real life and apply it to the field by means of charting, intervention. Things needed for the nursing process. For the input, we need chart, patient interview, observations, medical history, nursing history, and doctor's order. For the process, we need our brain, books, internet, dictionary, Nanda, medical dictionary, and more. And for the output, charting, interventions, nurse-patient interactions, and more.